Hello, this is Dr. Ken Berry bringing you a special update concerning COVID-19 and metabolic syndrome. There's a new study out of the University of Tulane showing that there's a very important link between having metabolic syndrome and your chances of dying from COVID-19. This is a brand new study that was just published yesterday in the journal Diabetes Care. And it reveals some very concerning associations between having metabolic syndrome and your risk of having severe complications up to and including death from a COVID-19 infection. Now, many of us in the healthcare community have worried about people with metabolic syndrome, which I'll describe in a little more detail in a second, and their risk of not only contracting COVID-19, but also of having severe complications of COVID-19. And this study really bears out the suspicions and the worries that we've had all this time. In this video, I'm going to explain to you quickly what metabolic syndrome is, why we think that it causes this increased association from severe complications with COVID-19. And then at the end of this video, I'm going to tell you what you can do if you detect that you have metabolic syndrome to start reducing your symptoms of metabolic syndrome, to start to reverse your metabolic syndrome, and therefore to improve your chances of surviving a COVID-19 infection. So first of all, what is metabolic syndrome? There are 5 basic criteria for being diagnosed with metabolic syndrome. If you have 3 out of these 5, then you're considered to have metabolic syndrome. It makes perfect biological sense that the more severe your metabolic syndrome is, the more truthful the statement would be that you're more likely to have a severe negative outcome with a COVID-19 infection, or indeed any viral or bacterial infection. So the 5 criteria for metabolic syndrome are having central adiposity. This is fat that you predominantly hold inside your abdomen or around your abdomen, high blood pressure, hypertension. You can have diabetes, you can have prediabetes, or what I consider to be probably the actual thing leading to metabolic syndrome is having hyperinsulinemia. You'll also have high triglycerides, and you'll have low HDL cholesterol. So if you have any of those 5, any 3 of those 5, then you do have the formal diagnosis of metabolic syndrome. And I don't want you to freak out or panic or worry. I want you to understand that metabolic syndrome is something you can take charge of and begin to reverse today. There's copious amounts of medical and nutritional research showing that if you have metabolic syndrome, that it not only weakens and confuses your innate immune system, but it also weakens and confuses your adaptive immune system as well. And so this puts you at increased risk of catching COVID-19 or any virus for that matter, including the seasonal flu, which is coming up. It also increases the odds of you having an inappropriate reaction or response to a viral infection. And this is what it looks like is leading to all the disastrous outcomes with COVID-19 infection. This new study out of Tulane shows a very concerning trend for people with metabolic syndrome who contract COVID-19. They have a double risk of winding up in the intensive care unit. They have more than a double, almost a triple risk of winding up on a ventilator. And then they have a more than double chance of dying from COVID-19. So this was a small study done at Tulane University, but I think that the findings are very concerning for you or any loved one or friend who has metabolic syndrome. I'm going to put a link to this study down in the show notes, and also links to other research showing a very strong connection between metabolic syndrome and having a weak and confused immune system. Metabolic syndrome probably weakens your immune system through several mechanisms. One being just chronic inappropriate inflammation that goes hand in hand with having metabolic syndrome. Also, hyperinsulinemia is going to cause inappropriate growths of some cell lines and suppress other cell lines. there's quite a degree of immune confusion. And so either your immune system will just miss the infection, or if it does catch the infection and start to respond to it, it's very likely that it will over-respond and wind up with you having disastrous complications from what otherwise could have been a mild to moderate infection. So what can you do to, if you have metabolic syndrome, to immediately start to reverse or cure your metabolic syndrome and thus lower your risk of having a disastrous outcome from a COVID-19 infection or any infection? What can you do? You may have seen the news stories lately about how the big food manufacturers, their sales have skyrocketed during our social isolation. And so all of their products are made out of sugars, grains, and industrial vegetable seed oils. And all three of these things are going to make your metabolic syndrome worse. And so if you have metabolic syndrome or suspect that you do, then I would highly encourage you to immediately try to drastically cut the amount of sugar that you're eating in your diet, whether it's natural sugar or added sugar in junk food. I would strongly encourage you to greatly decrease the amount of grains that you're getting in your diet, whether that's wheat, rice, oats, or corn. They are increasing your triglycerides, they're increasing your levels of inflammation, they are making your metabolic syndrome worse. And then thirdly, I would counsel you to please drastically reduce the amount of vegetable oils you're eating in your diet or cooking with. And these include canola oil, soybean oil, sunflower oil, safflower oil, peanut oil. All of these oils are very high in omega-6 fatty acids, which lead to chronic inappropriate inflammation in your body and can, it looks like they can also increase your risk of developing metabolic syndrome. As you eliminate these three things from your diet, what you're going to wind up eating is a low carbohydrate diet. There are different styles of low carbohydrate diet. You can do a low carb Mediterranean diet. You can do a very low carbohydrate diet, which winds up being a ketogenic diet. Or you can just eat meat and animal products, and this is called a carnivore diet. Any three of these are going to start to improve your metabolic syndrome overnight. Within one day, your numbers will start to move in the right direction. If you have severe metabolic syndrome right now, then I would encourage you to do anywhere between 1 month and 3 months of a carnivore diet filled with fatty meat, fatty animal products. This is going to reverse your metabolic syndrome quicker than anything. There's no pill, there's no injection, there's no medical treatment, there's no surgery that's going to reverse your metabolic syndrome quicker than 90 days of a carnivore diet. And then at the end of that, when you reverse your metabolic syndrome, you can decide with a little more safety, because, you know, flu season's coming and obviously COVID-19 season is all over us. So if you have severe metabolic syndrome, you've got to take charge of that immediately. And there's no quicker way to reverse it than a carnivore diet. But after you've done that, then you can decide, oh, I want to eat a low carb Mediterranean diet, or I want to eat a ketogenic diet, or some other variant of a low carbohydrate diet. But just realize human beings are by design a low carbohydrate mammal. If you feed us too many carbohydrates, we get fat, we get diabetes, we get fatty liver, and we get metabolic syndrome. And so after you've reversed your metabolic syndrome, don't think that you can go back to eating the junk that the big food manufacturers would like to sell you. That is not human food. You should never eat that again, okay? And so then you can pick some spectrum of the proper human diet, which is by definition a low carbohydrate diet that avoids sugars, whether added or natural, avoids grains, and avoids chemical factory made vegetable seed oils. If you know someone with metabolic syndrome or someone that you care about who you suspect has metabolic syndrome, I implore you to share this video with them. It could literally save their life, save them from an intensive care unit visit, save them from being on a ventilator. Again, I'll say the research that I talk about in this video, there are links to the research so that you don't have to blindly believe what I'm saying. You can read the research for yourself. If my videos help improve your health in some way, please take 1 second and click on my Patreon link. It's down in the show notes. It's a super quick sign up. you can throw a buck or two my way so that I have more time and more resources to be always looking at the research for you and then sharing with you the results and the nuggets of wisdom that I glean. This is Dr. Barry. I'll see you next time.